us. She's an assistant professor of medicine at Mount Sinai Hospital in New York. So, Luiza, why are we seeing the Latino community so much more impacted by COVID-19?
Indeed, Latino communities takes the hardest hit when it comes to COVID, and for a few reasons. First of all, it correlates directly with a social economic status, and second, Latinos tend to be more affectionately close to each other, and they live in these crowded families with multi-generations.
Interesting. So talk to us about socioeconomic status. You mentioned it. How does it play a role in, the rate of coronavirus cases that we're seeing? And
Across the board, there are a few reasons why minorities are more impacted. Number one, they're more essential workers. They can't afford to stay at home. They are nurses. They're involved in the food chain supply, and they are field workers. Second, in general, they have less healthcare coverage, and they do have more comorbidities. Third, they have low income. They can't afford to stay at home, and most minorities lost their jobs.
Now, what about the immigrants in detention centers in the U.S.? Apparently, there was an outbreak there. How has the government been dealing with that?
We have currently around 23,000 immigrants in detaining centers, and we have almost 3 outbreaks in Pennsylvania, Arizona, and Texas. There are very few things that have been done at a government level. They haven't even implemented the most basic measurements recommended by CDC to mitigate the spreading of the virus. However, a judge ruled that by June 17th, all children to be released to their families or safer homes. Also, some detention centers have redistributed their detainees to less crowded areas in different facilities.
All right. Well, Luiza, thank you so much for joining us. Our next interview is going to be about how we tackle this issue, how the government tackles this issue. All right. But we are moving on. Black Lives Matter protests are continuing.